Now we will see how to perform a screening of preeclampsia with SSDWLAB6. As usual, first of all, we enter to the web program with our username and password. Once inside the program, several options are presented, and we chose the option Add Patient. We can observe that a folder called Patient appear on the screen, where we will enter the data of the patient, her surname, first name, CIC, or the identifier used, date of birth, used to calculate the age of the patient, and the race, ethnicity of the patient. In this example, the patient is Caucasian. We chose the option Patient Test. When we mark this option, what we do is that the data from this screening is not taken into account in quality controls and not involved in statistical data. Once completed this, we will save the patient, and we go to the next folder. The following folder is Pregnancy folder. Here we enter the weight of the patient, unlike the aneuploidy screenings. In the preeclampsia screenings we should report the height of the patient, and which together with the weight allows the calculation of body mass index that is necessary to compute the risk of preeclampsia. We mark as single fetus pregnancy, and in the type of pregnancy in this case we chose the option spontaneous. We could also inform the last menstrual period. But there are other methods to compute the gestational age. The next folder is the screening folder. First we select the date of screening. In the screening profile we choose the preeclampsia profile. We can observe that when we select this profile, the appearance of the screen changes a little. Appear a frame with the dichotomous maternal markers, which allow us to add background information on preeclampsia and other factors that relate to this illness. We can note that has also appeared a frame called arterial tension, which must be filled with the date of the measurement, and the values of systolic and diastolic pressure, although the software allows to enter 2 measurements of each arm. The software allows the calculation using only 1 measurement, systolic and diastolic of 1 arm. The correction factors and maternal dichotomous markers are 3 state boxes. When the box is a dull blue color when it is being edited, gray when we save it means not informed, not valued. The empty box means no, and the box with the verification check means yes. By default these are in not valued state, unless some previous information has been reported that conditions their status. Like hormonal stimulation, which is marked as no, since it has previously been reported that the type of pregnancy is spontaneous. Or the African Caribbean, which is marked as no because previously we informed that the patient is Caucasian. For the correction factors, no and not informed, not valued is the same at calculation level, it only modifies the risks when it is a yes. But obviously at a statistical level no and not informed is not the same. For maternal dichotomous markers at calculation level, no is not the same as not informed. Since when it is no the baseline risk decreases, and consequently the final risk, and when it is yes the risk increases. In fact, the markers that affect the calculation of risk are the first 4. The others can be reported if we know them, since it is known that they affect risk but it is not yet known to what extent they do so. In this example we mark all of them as no. If we move to the following folder we come to the blood test folder. In this folder, we must enter the date of sample collection that in general is the same as the screening date. The sample number and the values of the Gaussian biochemical markers, which in this case are the pregnancy-associated plasma protein A and the placental growth factor. The following folder is the ultrasound. We define the date of ultrasound. We have the possibility to report the ultrasound unit and the sonographer. Then we enter the value of the CRL that is used to calculate gestational age. And we also fill the values of the uterine artery Doppler, with both right and left pulsatility index. And finally we come to the last folder, the risk folder. We can observe at the top of the folder we find the estimated risks, the basal risk of early and late preeclampsia, and the final risks of early preeclampsia and late preeclampsia. The risks are represented by color bars, when the risk is high in red, when the risk is low in green. And the basal risk is always displayed in yellow. In the middle of the screen, the information about the Gaussian markers involved in this profile, their values and their respective non-corrected and corrected MOMs. At the bottom of the screen there is information relating to gestational age estimation, the gestational age at the screening, blood test and ultrasound date, the expected date of delivery and the patent's age at the expected date of delivery. We also find a box that lets us enter details that will appear in the report. We have mentioned that at the top, next to the computed risks there is a frame called diagnosis that once we would know the diagnosis, we may introduce the diagnostic values, both early and late preeclampsia. It would allow us to classify the screenings in true positives, true negatives, false positives and false negatives. On the left side of the screen there is an informative summary of the patient's screening, where appear the results, risks and MOMs, and a summary of the information introduced. Highlight the presence of two buttons, the validate button that allows validating the screening once it is completed, and the report button that generates a report in PDF format with the estimated risks. When we validate a screening, the aspect of the screen change a little. And once the screening is validates, we cannot edit any data that affects the risk calculation. The report can only be generated when the screening is validated. The report is summary of the screening. Patient details, arterial tension, biochemical data, ultrasound data, maternal dichotomous markers and computed risks. So far we have performed a screening for preeclampsia from the beginning. Let us now see how to perform a preeclampsia screening in a patient who has undergone a first trimester aneuploidy screening. If we go to Search Screenings, and we enter a first trimester screening, and we go to the screening folder, we will see that we have two options to add a preeclampsia screening for this patient's pregnancy: the Add option and the Duplicate option. The Add option, what it does is that we add a new screening to this pregnancy. We could select the preeclampsia profile in the new screening and from there complete the following folders: screening, blood test, ultrasound and risk. However, we have the other option, duplicate, which can be more comfortable and saves us time. The duplicate option. By clicking the duplicate button we select the preeclampsia screening profile. What it does is that all the aneuploidy screening data that is also used for the preeclampsia screening is dumped automatically, the correction factors, the dates, the PAP to the CRL. So that to complete the screening we will only have to finish reporting the parameters that are specific to screening for preeclampsia. These would be height of the patient in the pregnancy folder in case it was not reported in the aneuploidy screening, arterial tension, date and measurements, and maternal dichotomous markers in the screening folder, placental growth factor value in the blood test folder, and the pulsatility index of the intrauterine arteries in the ultrasound folder. Also comment if for some reason we have not been able to use any of the markers. Let us imagine that we do not have the value of PLGF. Well, we can do the calculation by disabling this marker in the Risk tab. And we would do the calculations with the other markers. Obviously it is better to use the 4 markers so that the calculated risks are more accurate. And following these few steps we have performed a screening of preeclampsia in the first trimester of the pregnancy.